Hello everyone, my name is Dr. Aashish Chaudhry. I'm head of the department for Department of Orthopedics at Aakash Healthcare Super Specialty Hospital, New Delhi, India. Today I'm going to talk about a very important disease which is called knee arthritis and what are the preventive and treatment strategies for patients suffering from this chronic disease. So let me start with the introduction, what all things we are going to talk about in this lesson. So we are going to talk about some introduction on the knee joint, what is the knee joint anatomy and how does it function. Then we are going to talk about what's arthritis, what is the definition and what are the main risk factors and types and complications related to various types of arthritis. Then we are going to talk about some statistics related to the incidence of arthritis in India as well as what is the global comparison. Then we are going to focus on some preventive and treatment strategies which are very essential to prevent the disease and also to reduce the progression of the arthritis from a simple stage to a complex stage. And last but not the least, we are going to talk about a very novel surgical program which is called a speed knee program, which focuses on providing end-to-end care in the way of the joint replacement surgery for those patients who are suffering from end-stage disease. So we'll start with something about the knee joint anatomy. So from the technical point of view, knee as such means mobile in the Greek language, and let me tell you, it is one of the most stressed joint in the body. As we see all along the evolution, we were walking, our ancestors were walking on all fours, and gradually from the four limbs to two limbs the evolution has happened, and because of that the entire load has started to focus on the knee joint. It is almost like putting hundreds of kgs of load on a small surface area, that is the knee joint. That's why knee joint is under stress even during the basic activities of running, walking, stair climbing, squatting, cycling. All these activities put a lot of stress on the knee joint. Let me tell you something about the anatomy of the knee joint. So knee joint is formed by three bones. One is the thigh bone, which is called the femur. The other bone is the leg bone, which is called the tibia. And on the front of the knee, there is a small bone which is called patella or the kneecap. The combination of these three bones along with a lot of muscles around, namely quadriceps or the thigh muscle, then the hamstrings and the calf muscles, and along with multiple ligaments which provide a lot of stability, yet at the same time provide a lot of range of motion in the joint. Collectively, this is called the knee joint. Now, it's a very interesting fact that when we walk or we do any kind of activity, how much load our knees are bearing. So for example, when we are cycling, it's almost 2 times the body weight. Our knees, under the load of the body weight. And when we are walking, it's 5 times the body weight load is coming onto the knees. Similarly, when we are climbing the stairs, it is 8 times the body weight. And last but not the least, when we are running, it's almost 15 times the body weight load. The knees are, continuously bearing while we are running at a reasonable speed. So that means all these basic activities we are not realizing, but we are putting a lot of stress on the knee joint. So let me come to the next topic, which is the arthritis. Now, how do we define arthritis? Arthritis is basically inflammation of the joints. That means swelling. In layman terms, we can call it swelling of the joint, just like we have swelling of the skin and soft tissues. If the joints also get swollen, because of multiple reasons, it causes inflammation. Gradually, it causes destruction or damage of the cartilage, which is the most important part of the joint, and gradually it converts into a chronic stiffness and deformity, ultimately leading to severe arthritis. Now, what are the various symptoms of knee arthritis or any arthritis per se? Most of the time, patients would start complaining of pain with all kinds of daily activities, and few patients will also report limitation of the range of motion. Many patients will come back with joint stiffness and joint swellings, and when they examine or they touch the knee, they always find a lot of tender points or pain points across the joint. And many patients who are suffering from moderate to severe arthritis, they will also complain of buckling or loss of balance while they are walking, especially on the uneven surfaces. And last but not the least, patients who are suffering from end-stage disease, they complain of a lot of deformities which are developing around the joint. For example, most commonly around the knee, we see a lot of bowing of the legs which happens, and that becomes the reason for imbalance, and ultimately it can cause falls in those elderly patients. So coming to the various stages of arthritis, especially the knee arthritis, which is the most common type of arthritis, there are 4 stages of arthritis. The stage 1, which is a doubtful stage, where less than 10% of the cartilage is damaged, and most of the time at this stage, patients do self-treatment or home care treatment, wherein they do some hot therapies, some oil massages, and most of the time they need not consult a doctor. But as the disease progresses from mild to moderate to severe, the deformity and the swelling and the pain because of the arthritis keeps on increasing. And if you look at the stages, the last stage being the stage 4 or the severe arthritis, we see complete damage of the cartilage or the lubricant, which is the surface which provides the function and the range of motion in the knee joint. So these are the 4 stages, and for every stage we have got a specific treatment and preventive strategies. Now coming to the risk factors and types and complications of arthritis, most commonly if you see, advancing age becomes one of the most common risk factor for knee arthritis. Then people who are more obese or they are morbidly obese, they have got more chances to contract arthritis. It has been seen that most of the patients, especially if we compare male with the female, females have got more predisposition to arthritis because of sedentary lifestyle and because of associated obesity and other chronic diseases. And most of the time, our Indian women are mostly confined to the home. They are not going outside, they are not involved in physical activities. So that becomes one factor contributing to increase incidence of arthritis in females. Then there are multiple genetic factors which also can contribute to development of arthritis, and many autoimmune disorders, for example, rheumatoid arthritis, SLE, hyperthyroidism or hypothyroidism can also contribute to development of arthritis. And there is a second class of arthritis which happens because of one of the injuries or infection which can affect any joint. So those are types of arthritis which happens after an injury or some event. They are called secondary arthritis. Most of the time we have seen many patients who suffer an accident, they get fracture of the joint, and thereafter they start developing arthritis in few years. Now coming to different types of arthritis, the most common arthritis is the degenerative or a mechanical type of arthritis, which is the most common. Along with the aging population is the most common common age group where people suffer from osteoarthritis or the degenerative arthritis. The second common arthritis is the inflammatory arthritis, wherein multiple blood parameters are also deranged, the most commonly being the rheumatoid arthritis, which is a type of inflammatory arthritis. Then there are some specific arthritis which only affects the kids. Most commonly is the JRA, which is called juvenile rheumatoid arthritis, and it can cause a lot of disabling disease and deformity in the kids, and we have to take early measures to prevent the long-term consequences. Then the arthritis can happen because of the infections, it can happen because of the metabolic disorders, and sometimes because the joint gets affected by a chronic infection or tuberculosis, that can also lead to different type of arthritis. Now talking about the complications which can happen because of the arthritis, if they go untreated, most of the time it is the first symptom patients report is a loss of mobility. If patients are suffering from arthritis, they are unable to walk, unable to carry out the daily activities, and that's the reason why most of the patients with arthritis go and seek consultations for the loss of mobility. And because of loss of mobility, they tend to gain a lot of weight, and that affects other systems like heart diseases gets aggravated, diabetes also goes uncontrolled, and many patients with disabling knee arthritis, they will also have the back problems. Now this inflammatory arthritis or inflammation of the joint can also spread to the neighboring joints, because if one joint is affected, it is possible that other joints also get damaged because of the over stress which is coming on those joints. And last but not the least, overall the quality of life decreases because the patient is not able to carry out the daily activities. Talking about some statistics in India per se, because of the genetic factors, because of our squatting habits, Indians are more prone to develop arthritis, almost 15 times more prone to developing osteoarthritis. If we look at the total disease load, more than 150 million people are affected from the knee problems, and out of that, almost 30 to 40% patients are suffering from end-stage disease requiring a joint replacement. Now, most of these patients, almost 60% plus patients, also have a chronic disease like diabetes, hypertension, heart disease, and that also complicates the arthritis scenario. Now coming to the preventive strategies, most of the time the prevention of arthritis depends on the age group where we are trying to act. For the kids and adolescent age group, I think the most important factor would be to maintain the weight, to get involved in one of the sporting or a physical activity, and of course use a proper footwear to make sure that you are able to carry out all the physical activity without putting undue stress on the knee joint. If we talk about the adult population, weight management becomes the core of all the preventive strategies for the knee arthritis. And if they are involved in regular exercise, whether it is walk, swimming, jogging, or any other physical activity, that also becomes one of the preventive measures to control the arthritis. And also, of course, proper gym techniques should be used if they opt for gymming or yoga as one of the measures to reduce the arthritis chances. Now coming to the elderly age group, we don't expect them to go into a very high contact sporting activity, but yes, a lot of balance exercises, usage of assisting devices, and regular checkups with the doctor, I think they can control the arthritis to a greater extent. Sunlight becomes a very important factor, because in India, most of the people are indoor. They are hardly able to get adequate sunlight exposure. It is said that most of the people who get 40% of the body exposed and get early morning sun exposure for at least 30 minutes, there is a high chance that we are able to get enough vitamin D synthesis in the skin, and that also helps in calcium absorption in the body, indirectly preventing the osteoarthritis. So looking at the other aspects, holistically, what all we need to maintain the knee health, not only the vitamin D and calcium levels of the body, but our diet should have adequate amount of proteins, adequate amount of fruits and vegetables. Overall, it should be a balanced diet which can promote good muscle health, which can promote the muscle repair, and also maintain the bone health. Now this slide shows very clearly the TDS of the tap water versus the RO water. Now we have seen that whenever we are using RO water, which is a commonly used device in most of the households, we see the TDS level goes less than 100. So in this picture you can see it's coming 49 milligram per liter. Now any value less than TDS value less than 100 is not good for our health, because most of the essential minerals also get depleted. So it is advised that whatever RO you are using at home, we must make sure the TDS value is somewhere around 100, so that we are not losing the essential calcium and magnesium minerals because of usage of the RO water regularly at homes. So coming to the treatment part of the arthritis, so there are multiple ways we can manage. The first and foremost is the local therapies, the conservative management, which includes medication. Of course, a lot of people, they opt for using the painkillers, anti-inflammatories, NSAIDs. There are some other complex medication which are called DMARDs or disease modifying agents, but they are restricted from some specific arthritis. Not everybody can use it. Now there is a trend for using injections of PRP, steroids, and some greasing injections, which can also help in preventing or delaying the progression of the arthritis. But the newer techniques like stem cell therapies, magnetic therapies still have to have the long-term results to actually be used practically on the ground. Now coming to the other aspect with the physical therapy, that becomes the cornerstone of treatment of most of the arthritis. Even from the mild to severe stages, every patient will get benefit because of if they are continuously involved in one or the other physical therapy, either it is physiotherapy, regular exercise at home, or even swimming or any kind of yoga activity. All these activities are going to help in a long way to preventing the progression of the arthritis. Focusing on balanced diet is also significantly important. And if at all, after following all these conservative measures, if patient is suffering from severe arthritis, then the only option which is left is a surgical treatment. Most of the patients must be aware of the option of total knee replacement, or for specifically for knee arthritis. Many a times we have heard in my OPD patients complain about the risk factors, and there are a lot of fears around the procedure. Especially they feel that the knee is not going to last for more than few years. It can cause a lot of complications. The diabetic patients and heart patients cannot undergo a knee replacement, or similar such fears are prevailing among the population. So most of these things can be managed through a particular strategy. So what we are trying to present here is a specific program which is called a speed knee program. Now here the speed word doesn't mean how swiftly we are doing the procedure. It is an acronym which stands for 5 elements. I feel that to conduct a successful knee replacement, one should have a team approach for every patient. The first element of our approach is the safety of the patient. That means whatever procedure we do, we should make sure that all the measures, all the factors which may cause problem to the patient because of the surgery, they should be taken care of, whether it's a medical control, whether it's diabetes control, whether it's a heart disease management. All those things have to be evaluated, and then make sure the patient is safe enough to undergo the procedure. The second part is the painless procedure. We have to make sure that knee replacement, despite being a painful procedure, there are multiple modalities which we follow, like cryotherapy, adductor canal block, and many other modalities which can make the surgical experience pain-free. The third element of our program is the exact fit. That means most of the time when we use robotics, when we use artificial intelligence and machine learning, these are the new tools which have come up big way in healthcare, and they can provide a lot of accuracy and precision when we are trying to operate the knee with focus on longevity of the implant. The fourth factor in our program is express recovery. That means whenever we focus on the knee patient after the procedure, we have to make sure that we should start the patient on rehabilitation. The first walk has to start in first 4 to 6 hours, and then there is a journey of 4 to 6 weeks of regular physiotherapy, gradually making the patient capable to carry out all his or her daily activities with ease. And last but not the least, the durability of the procedure. So it doesn't only include the durable implant, which can last for more than 2 decades. It also includes the teamwork which comes into play to provide all the factors important to make the joint supple, strong, and able to bear load for next 2 to 3 decades. So this holistic program is focused on providing excellent care for those patients who have exhausted all the conservative options. Still, they are not able to carry out daily activities, and surgery is the only option for them. So I feel on this program, in last 8 years, we have operated more than 5,000 joints, people coming from various countries, and we have realized that using this program, we are able to discharge the single side knee replacement within 3 to 4 days, and the bilateral knee replacement within 4 to 5 days of the procedure. And at that time of discharge, patients are able to carry out basic activities of daily living. So I'm sure that once we follow this program, we are able to give a happy knee and a mobile life to the patient if we are following all the elements of the program. Now coming to a small video which shows clearly the application of the speed knee program. You can see the before and after images, what shows an excellent transformation of the patient who was suffering from very severe arthritis, and they tried and exhausted all the conservative options. Still, they were unable to carry out the daily activities, and with the help of speed knee program, we were able to give that kind of comfort and confidence in walking, in ambulation, and doing all kinds of daily activities. To summarize, I would like to reiterate that knee arthritis is one of the most disabling disease for the elderly population, and in today's time, with the kind of medical treatment and surgical options available, and with the team effort and along with the technology, we are able to address all types of arthritis with a multimodality approach. And I'm sure that if patient follows the consultation and takes the advice properly, they will definitely have a good quality of life at the end of the day. Thank you so much for patient listening.